Caribbean tourism has seen its worst attack in decades, and you can blame it all on the COVID-19 pandemic that's brought the industry to a standstill, with hotels closed across the region. Joining us to discuss the issue and the industry post-COVID-19 is Chief Executive Officer and Director General of the Caribbean Hotel and Tourism Association, Frank Comito. Good morning and welcome to the morning edition, Mr. Comito.
Good morning. Thank you for inviting me.
How would you sum up the situation for the sector under the current COVID-19 pandemic?
Oh, this has been devastating, not only for the tourism sector, but certainly for the economies of the Caribbean and the people of the Caribbean. But we seem to be handling it well relative to what we're seeing around the world. So while it's been devastating and there'll be long-term impact, we have the ability to shorten that impact and get tourism slow return to some new type of normal soon.
Let's talk more about that impact in terms of dollars and on the unemployment standing.
Well, we don't have regional unemployment figures yet, but our industry employs in the Caribbean about 2.4 million people prior to the crisis. We estimate right now that more than half of those folks are temporarily unemployed. And over 90% of the hotels in the region, of the 2,000 hotels in the region, are closed or suspended operations. So the consequences of that are tremendous because there's a ripple effect of all of that, as we see in the Bahamas. Tourism, we like to say in the Bahamas that tourism is everybody's business, and certainly we see that ripple effect because it goes into purchasing power of people, into supermarkets and hair salons. I mean, the whole bit gets impacted when tourism, when we see that trickle of tourism dollars disappear. So it's devastating, and it will take some time to return. But there's a lot of collaboration going on at the local level. I'm really happy to see what I'm seeing at the Bahamas level from a tourism industry stakeholders, public and private sector, working with the Prime Minister's office and so on to work on a number of things to move towards a recovery eventually.
Now, you talk about shortening the impact, if at all possible. How challenging would it be to get the industry back to some state of normalcy?
Well, the good thing is, unlike a hurricane, which can devastate infrastructure, our physical plant, if you will, our infrastructure, our airports, our hotels, and so on, are not destroyed. So there's no rebuilding that has to occur there. There is some revamping and that has to occur. New supplies have to be purchased, food supplies and all those kinds of things. But we anticipate that the comeback is going to be slow and steady, at least over the coming through mid next year. A slow, steady kind of comeback, which means that some of the properties, the hotel properties, are going to open up in a staged way. So with that allows a revving up, if you will. It allows them really the ability to put in the health safety protocols that are so important for employees as well as for the health safety of visitors as well. So all of that is really critical to be able to build up consumer confidence as well, that it's okay to travel to the Bahamas or the Caribbean, that they're taking it very seriously. And we're seeing collaboration around that health safety readiness at the local levels, but also seeing we're part of a regional initiative that's working on that as well.
Now, that said, what advice would you offer to the respective island destinations as they prepare to reopen or reshape the industry?
Well, I think we have to err with caution. We have to use this downtime to get our systems and protocols in place, do some training, self-professional development. There's a lot of free stuff online like that. So just getting our game in place so that when things do start to open up, that we're ready to deal with it. That's a readiness at that level. But at an individual level, and this is really important for all of us, every citizen, every resident of the Bahamas and the Caribbean, is to follow the health safety protocols that the health professionals are advising on in your destination, in your country. Absolutely critical. If we move too quickly or too carelessly, we will see this sustain. And instead of seeing people back to work in mass by sometime next year in mass, I think they'll slowly be coming back over the next couple of months. We anticipate about 70% of the Caribbean hotels to be reopening over the next 2 months, 2 to 3 months. So, but in the meantime, there's things we've got to do to make sure that we don't accelerate a return of this virus into the Caribbean. We've been relatively isolated because we are islands. We can control our borders much more effectively than places like Europe and the United States. But that could backfire on us very quickly if we're too careless. We're seeing a lot of reckless lack of social distancing occurring out there, and every resident has a role and a responsibility not only to protect the health and safety of their fellow residents, but also to be able to help accelerate a recovery and a return so people can get back to work, so government revenues are coming in to be able to support all the kinds of incredible needs that we have because of the costs that this pandemic has incurred.
Share with us some plans from where you sit on the pending situation with the cruise industry.
Well, the cruise industry is working aggressively to, they've always had fairly good protocols on health safety. So we were really taken aback that this happened, that with what happened. They've been a model for some of the types of viruses, the norovirus and things like that we see occur sometimes in those closed types of environments. So we're really surprised to see what happened. So I think they're going through a very aggressive approach to looking at their health safety protocols, how they're operationally set up within the layout of a ship and all of that. And it's probably going to take, all of our data says that the recovery, in terms of recovery, it's going to first be more at a domestic level, and then it'll be more at more of a regional level. And from an international travel point of view, we'll start seeing short-haul travels. As soon as borders start opening up, we're going to start seeing that. Not en masse. We're looking at hotel occupancies that are probably going to be 10 to 20% through the summer once we start opening up again. And that's going to continue in that vein through the end of the year into early next year. And it depends on what happens again. If we are careless, if we enter into another cycle, if we're too aggressive too soon, we will see a return of this, and the pain will be longer, and it'll be quite severe. So we have to really adhere to these health safety protocols early on and get our game in shape that way.
Any possible timeline on the sector in terms of its comeback?
Well, history has told us that it could be anywhere from 18 months to 4 years. So to get to where we were before the pandemic. So layered on top of all of this is the fact that this is accelerating a global recession in a big way, and it'll probably be quite severe recession, even though we'll start coming out of it, and there will be people that are able to travel and spend money, and we can benefit from that. We anticipate it's going to take some time to get back to where we were before, and even at that, it will be the term that we're using quite freely nowadays. It'll be a new normal.
Well, thank you so much, Mr. Comito, for joining us on the Morning Edition.